Namaste. I am Dr. Arnab Barma, Senior IVF Consultant, Crysta IVF, Kolkata. Today the topic of my discussion is IUI and expert tips for successful pregnancy. Let's begin with IUI. What is IUI? It is intrauterine insemination. If infertility treatment is a stepwise method, then it comes into the third step. The initial two steps are natural conception, next is ovulation induction with timed intercourse, third is IUI, and the fourth one is IVF or in vitro fertilization. In IUI, in short, what happens? We give ovulation induction. When the lead follicle is around 18 to 20 millimeter of size, then we give trigger injection. After giving the trigger injection, within 36 hours, we ask the patient to visit our clinic. When the patient arrives in our clinic, then we do a TVS to check whether ovulation has occurred or not. How do we know that ovulation has occurred or not? By doing a transvaginal scan usually. Otherwise, we can also do transabdominal scan also. We will see that there is a corpus luteum in the ovary and there is some fluid in the POD. When the ovulation is confirmed, then we ask the husband to give fresh sample of semen. We wash and prepare the semen and put it inside the uterus of the woman. This is what the IUI procedure in short. Next comes the expert tips. So the tip number one is, see, for ovulation induction, we used to use many drugs previously. The most common drug used is clomiphene citrate, which is a selective estrogen modulator. The dose was 75 milligram previously, but nowadays up to 150 milligram also we can use. But while we use this clomiphene citrate, the common side effects of clomiphene citrate you should always remember, that is vision loss, mood swings, and it can also create ovarian cysts and it can decrease the endometrial lining. That's why clomiphene citrate is not preferred nowadays. Tip number two. The tip number two is, if you use clomiphene citrate, then definitely add HCG. It will definitely enhance the pregnancy rate, what we have seen. Next comes the tip number three. Tip number three is, nowadays we use letrozole, that is a non-steroidal aromatase inhibitor. The dose is 2.5 or 5 mg for 5 days from day 3 to day 7 for ovulation induction. Now comes tip number 4. Tip number 4 is, for polycystic ovarian patients, we should add HMG or recombinant FSH alternative days at least for 3 doses. It increases the pregnancy rate. That is what we have seen. Next comes the tip number 5. The tip number 5 is correct time of giving the trigger. When we see that the lead follicle or the dominant follicle has reached 18 to 20 millimeter of size, then we give the trigger. The trigger usually is HCG 5000 international unit to up to 10,000 international unit. After giving the trigger, we call the patient after 36 hours. After 36 hours, when the patient enters our clinic, we do a TVS. By TVS, we check whether the ovulation has taken place or not. How can I see, or how can I detect that whether ovulation has occurred or not? By TVS, we can see a corpus luteum in the ovary, or we can find some fluid in the pouch of Douglas. After confirmation of ovulation, the tip number 8 is, then and then only you ask the husband for fresh semen sample. Once the husband gives you the fresh semen sample, we wash and prepare the sample and we put it inside the uterus of the woman. Now the tip number 9 is, always do a folliculometry. In some centers they do not do. You always do the folliculometry, then you can be assured whether the lead follicle has grown up to 18 to 20 millimeter of size or already it has been ruptured or not. Next tip is, if you are going with husband semen or partner semen, then definitely you also have sexual intercourse with your partner, because it will enhance the pregnancy rate. The last but not the least, the tip will be some tips for health. As we are doing partner treatment, treatment of the couple as a whole, then for both of you, smoking and alcohol should be avoided, because it has got negative effect on the gametes. That means both on eggs and sperm quality. What you do regarding the diet, you should take more green vegetables and fruits. So these are all the expert tips regarding IUI procedure. If you would like to know more about IUI, then definitely you can contact us, or you can put a comment in the comment section below. That's all for today. Thank you.